Yeah.
Hello.
Hello.
How are you?
Well, how are you?
I'm very good, thank you. My name is Kathy, and today I'm going to be performing a lung, thorax, and cardiac assessment. But before we get started, can you just verify your name and your date of birth for me?
Ben, 4/22/1980.
Okay, and do you prefer to go by Ben?
Yes.
Okay, great. All right, so I'm just going to go ahead and get started with your thorax and lungs assessment, and then we'll move into the cardiac assessment. So to begin, I'm just going to have you sit upright, and I'm just kind of observing your respiratory rate. I'm looking at your ease of breath, looking for any use of accessory muscles, and I'm looking for any asymmetry or any deformity. And everything looks fine. I don't see any use of accessory muscles. You don't appear to be in any type of respiratory distress, and I don't hear any concerning lung noises just by listening. So the next thing I'm going to do is just check here at your sternal notch, and I'm just looking to make sure that everything is midline. Your trachea is not deviated to one side or the other, so everything is good there. I also need to take a look at your fingers here. Everything looks good. There's no blue color to the fingernails. And then I'm looking also at your lips to see if there's any whiteness or blue tones of the lips, and your lips look nice and pink, so no problems there. So just kind of relax for just a second. Did you sleep well last night?
Mm-hmm.
Okay, just checking your respiratory rate there, which was 16. So that's perfectly normal. Adults have a respiratory rate between 14 and 20, so no concerns there. So if you don't mind, I'd like for you just to kind of turn to this side a little bit. I'm going to do an assessment of your posterior thorax. So again, I'm just looking at the contour, looking to make sure that everything is symmetric, looking for any type of deformities. And then now I'm just going to kind of press a little bit here and just kind of feel, are you having any tenderness at all? Okay, so what I was doing there was just checking for anything concerning like potential bruises or trauma, like suspicious for rib fracture. So everything looks fine there. So now I'm just going to have you sit up nice and tall and take a deep breath in and let it out. Do one more for me. Okay, great. So what I was doing there was just checking your chest expansion, and it's important to see the hands move out and then come back in. So everything was good there. So the next thing I'm going to do now is just listen for or feel for tactile firmness. So I'm going to have my palms of my hands on your back in various areas and just have you say 99, 99 until I ask you to stop.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, you can stop. That's great. Okay, so the next thing I'm going to do is percussion. So you're going to feel me tapping across your back in a ladder-like motion, and you're just going to hear some sounds as I do this. Okay, great. So now the next thing I'm going to do is just have you take a deep breath in and out, and in and out. So here I'm just checking for something called excursion, and I'm just making sure that your diaphragm is moving properly. So now I'm going to listen to your lungs with my stethoscope, and it's going to be the same ladder motion that I've been using. I'm just going to listen for lung sounds. Deep breath in and out. Okay. So if I were to have heard abnormal breath sounds, I would continue on to do something called bronchophony. I didn't hear anything abnormal, but for the practice, we're going to go ahead and listen anyway. So I'm going to listen again in that ladder pattern, and as I listen, I would like for you to say 99 until I ask you to stop. You can begin.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, very good. So what I was listening for there were muffled sounds. If I would have heard something louder, then I would have been concerned about some type of consolidation. So I'm just kind of taking notes and recording the findings as we go along here. So the next thing I'm going to do is listen for egophony. So what I would like for you to do, I'm going to listen again in that same pattern and just have you say E, E, E until I have you stop.
E, 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 E.
Okay. So what I was listening for there was if there were some consolidation, the E sound would sound more like an A. So the last thing I'm going to check is pectoraloquy. And so what you're going to do is whisper 1, 2, 3, 1, 2, 3 over and over again until I have you stop. Okay, you can stop. So the last thing I'm gonna do, I'm gonna have you say 99 again. I just wanna make sure I'm gonna listen for tactile or feel for tactile fremitus.
99, 99, 99, 99, 99, 99, 99.
Okay, that's good. You can stop. Okay, so now I'm just gonna have you switch positions and lay down here with your head on the pillows. Okay, so now what I'm going to do is just take a look at the front of your chest, and I'm just looking for, again, any asymmetry, any type of deformities. Make sure that your respirations are still even and non-labored, so everything looks good there. I'm just going to also feel to make sure that there's no pain or discomfort. Are you feeling anything there? Okay. All right, so that's normal. So the next thing I'm going to do is palpate for tactile fremitus. So again, if you could just say 99.
99, 99, 99, 99, 99, 99.
Okay, very good. And then I'm going to do also percussion as well. So you're going to hear some different sounds as I percuss over the heart. It's going to sound a little bit more dull. Then you're going to hear a different sound as I percuss kind of over this air bubble of the stomach. You hear the different sound there. Okay, very good. So now I'm just going to have you breathe in and out with your mouth slightly open as I listen to your chest again in kind of a ladder formation. Okay, very good. You can just breathe normally. Okay, so now we're going to move on to the cardiac assessment. And the first thing I'm going to do is check for jugular venous pressure. And the best way to do this is if the head of your bed is elevated 30 degrees. So the first thing I'm going to do is if you could just look this way for me, I'm just going to look here at the veins in the neck and then turn this way for me. So I'm looking for the pulsations here. Okay, I have that at 2 centimeters, so that is normal. The next thing that we're going to do is check your carotid pulse. Just know that if you ever do this at home, you want to listen as or feel the way I'm going to one side at a time. Okay. Okay. So now we're just going to listen for any bruise. Just turn your head that way for me. Okay. Okay. Very good. Okay, so now what I'm doing is just checking your chest for any type of heaves or lifts, and I'm just going to feel as well just to see if there's anything heaving or lifting as you're resting here. Okay. So now I'm going to find your apical impulse. And it's just a tapping that you feel in the chest. And then now I'm going to listen to your heart sounds, and there are 6 important areas to listen to. Okay. Okay, then that concludes our assessment for today. Do you have any questions about anything that we did? Okay, well, thank you very much.